It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our first guest, Dr. Johnathan Hodax, a board-certified orthopedic surgeon. He specializes in minimally invasive surgery, knee, shoulder, and hip, and we're going to be talking about some treatments of fractures today, Shannon.
Yes, we are. I mean, again, we're talking about minimally invasive surgery. This is the new surgical intervention that allows the patient increased recovery and less trauma during the surgery itself.
Shannon and Dr. Hodax.
Dr. Johnathan Hodax, welcome to Health Talk. How are you?
I'm doing great. Thanks so much for having me here today. I appreciate it.
Thanks for joining us. Tell us a little bit about your background, your history. You recently relocated or moved to the Northwest. I think you said you've been here about 5 or 7 months. Welcome to Northwest. Tell us about your background.
Oh, thanks so much. Yeah, I grew up and down the East Coast, went to undergrad at Maryland, master's at Georgetown, med school in New York, and did both my residency and a trauma fellowship at Brown. Came out to the West Coast for a sports medicine fellowship at UCSF and happened to be settled down here in Seattle finally.
And you're settled down at Virginia Mason, working in the sports medicine area. Tell us about your training. You talked about residency. You seem like you probably did a fellowship. Most orthopedic surgeons coming out today have this fellowship training, which I think is really impressive. Tell our listeners about your fellowship training, your interest in your orthopedic practice.
Yeah, that's right. So I'm one of the few people you'll meet who actually has 2 fellowships. So I did a fellowship in fracture care and orthopedic trauma out east, and a fellowship in sports medicine and shoulder surgery out west. And that was training under Ben Ma, getting to work with the San Francisco Giants, getting to work with a couple of big teams, big colleges, and really diving in and focusing on sports medicine injuries.
Well, congratulations, Virginia Mason. I think it's pretty apparent, and it's in the media that you guys are going to be involved in NHL Seattle, the new hockey NHL team coming to Seattle, which is going to be fantastic. I'm excited. You got to be excited. You have some hockey background. Right?
That's right. I took care of the feeder team for the Providence Bruins. That was a feeder team for the Boston Bruins. Really excited to get the chance to take care of an NHL team, working with my partner Dave Belfi, and I think Seattle is ready for it.
Yeah, that's exciting. I've got tickets already. I'm excited to be on the ice level. Hockey is such a fantastic sport. We're going to talk about shoulders and talk about shoulder injuries. I mean, hockey players have a lot of AC joint separations. They're getting checked into the boards.
Absolutely.
A lot of contact. But today we want to talk about the shoulder mechanics, particularly as it relates to what we call in the medical world a slap lesion. Let's talk about the anatomy of the shoulder. Let's set it up from muscles, tendons, ball socket, and then we'll talk about the slap tear.
Absolutely. So in the shoulder, the humerus, the bone of the upper arm, meets your shoulder blade in a kind of golf tee typed cup that's called the glenoid. Around that glenoid, to make it a little bit deeper of a socket, we have what's called the labrum, which is cartilage that makes a circle around it. And attaching right at the top of that, we have one of your 2 biceps tendons, the long head of the biceps tendon. If you imagine it, it's kind of like a lasso making a circle with a string coming off of it. And right at the top, that's kind of a weak point in it where we get these superior labral tears. SLAP is superior labrum from anterior to posterior tear, and that's where we're getting a lot of these new injuries that we're talking about more and more.
I love these acronyms in healthcare. A slap lesion, that's awesome. So great job anatomically. So would this cartilage around that socket, that glenoid, be similar to the cartilage that makes up your meniscus and in some other joints of your body?
Exactly. It's called fibrocartilage. It's kind of tougher, leathery cartilage. It's just like your meniscus. It's just like the labrum in your hip as well.
And good blood supply in the shoulder, or like the meniscus, kind of a challenge with blood supply in that area of cartilage?
It's a challenge for blood supply. You're absolutely right. And the other problem is that your joint fluid is designed to protect your joint. So anytime any sort of clot or healing starts to form, your joint fluid dissolves it and washes it right away. And so that's another reason why these have a hard time healing on their own.
Interesting. So this long head of the biceps tendon goes up and attaches on that labrum at the top, at almost like 12 o'clock on a clock on the socket.
That's exactly right.
And then at times, tell us the mechanics of this injury, because this is an overhead athlete, a throwing athlete sometimes, and sometimes really hard to determine what's going on.
You're absolutely right. I think of slap tears as 3 different populations. There's the everyday athlete who gets some shoulder ache and soreness. We get an MRI and see this on there, and our physical exam corroborates with it. There's high-level athletes outside of overhead throwers who get these injuries. They're pretty common in swimmers and anybody doing a repetitive overhead movement. And then there's the baseball thrower, the what we call late cocking or big external rotation moment in baseball is a major factor in irritating the superior labrum and pulling on that biceps tendon complex.
And that pulling or irritating that biceps long head irritates that cartilage, loosening that cartilage or tearing that cartilage in that area.
That's exactly it. We can get soreness, we can get tearing, and we can get peeling away of it.
Back with Shannon O'Kelly, Dr. Johnathan Hodax, right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Dr. Johnathan Hodax talking about slap tears with Shannon O'Kelly.
Well, Dr. Hodax, again, thank you for joining us. We're talking slap lesions, this irritation, the long head of the biceps in that cartilage, that labrum of the shoulder joint. You described 3 types of athletes that may experience this, signs and symptoms, how you evaluate, diagnose it, and then treatment options. Let's go ahead and get into that body of work.
Absolutely. So for most everyday athletes or swimmers, people doing some basic repetitive overhead work, they're going to start to notice pain in that overhead motion as they come around the 12 o'clock position of arm rotation. They may notice pain holding objects forward away from their body, and that pain tends to be at the front top of the shoulder and radiating down their biceps. It's a really common position for that pain to strike. In our pitchers, what we hear over and over say that their pitch is either losing speed or they can't find what pitchers refer to as the slot. Their arm mechanics aren't hitting that exact position, and either they're slowing down or losing control or both.
Does there have to be a history of trauma, or can it be just repetitive overuse?
More often, this is the repetitive overuse, and it's a gradual show up. Now, with a shoulder dislocation, with a sudden traumatic event, these can show up too, and so that's a little bit different of a presentation and a little bit harder to take care of. In terms of how we identify these, that's our history. Our physical exam is going to involve a lot of tests of the doctor manipulating the patient's arm, checking different positions for both strength and comfort. Sometimes we're just looking to see, can you get the same strength on this side that you can on the other side? But sometimes we're looking for how much does this irritate you? How uncomfortable are these various positions that we put your arm in for you?
And then if you suspect this on a history physical, definitive diagnostic test, what are you using in today's technology advanced world?
We're typically confirming our diagnosis with an MRI, and it also gives us a sense of the anatomy of the tear. Now, sometimes that MRI may include an injection of dye into the shoulder to give you a little bit more detail. Some doctors are more comfortable without that based on the quality of their imaging and how clear the diagnosis is from talking to the patient.
Are you going to repair this injury, or are there times, I know there's a little controversy out there with these slap lesions. Why don't you set us up there?
That's the best question. So for most people, the first step is to try physical therapy. A lot of the time, the irritation and inflammation in the shoulder can be calmed down by supporting the muscles around the biceps tendon attachment, and patients don't need surgery. The recovery for surgery is obviously longer. In-season athletes would be taken out of season to go through a surgery and recovery, and we want to try to avoid that. In people who can't get through their pain with physical therapy alone, there are 2 different kinds of surgery that we talk about. For some athletes, that's repair. And for some athletes, it's actually reattaching the biceps tendon elsewhere in its normal course. We call that a biceps tenodesis. Mm-hmm. Now, you'll see a lot of literature on this if you look. And on average, high-level athletes get back to sport at a higher rate with a biceps tenodesis, with changing their anatomy and getting rid of this weak point, than they do with the repair. But high-level pitchers, high-level throwing athletes report that it changes their mechanics, they don't feel as comfortable, and pitchers specifically have a harder time getting back with the tenodesis.
So your job as a surgeon is really preservation of function, and obviously you're doing this minimally invasive through arthroscopy?
That's right, we're doing this through a scope, and we want our patients to be as comfortable as possible. We want to get them back to their sport as soon as we can.
Johnathan Hodax, thank you so much for your time, thank you for the great information, and thank you for joining us on Health Talk.
Thanks so much for having me.
Well, Shannon, I had not heard about a slap tear until hearing from Dr. Hodax. Kind of recap that for us.
Well, a slap tear is basically a tear where your biceps tendon attaches on the top of the labrum, and sometimes that tendon pulls, and you get a little irritation, a little tear there, and sometimes they need to be fixed. And again, this is something that happens in a lot of overhead athletes, particularly throwing athletes.
All right, we'll be back with our next guest, Lynn Steffes, right after this time out on Como.